Have you ever wondered what is the difference between a counsellor, psychologist, psychotherapist, psychiatrist? In this video, I'm going to help you understand. So let me first preface that I am explaining things from the point of view of Australian training standards and ones that I undertook many moons ago. So let's start with counselling. Just about anyone can provide a form of counselling. Clergy and church leaders often provide counselling. You can get counselling at a prenatal clinic. You can get counselling from your doctor. Counselling is a very generic term that describes the practice of listening, advising, discussion, assessment, and potentially treatment options with a skilled practitioner. The skills and the training for being able to counsel can vary widely. Somebody could take a weekend workshop on how to listen empathically and reflect back in what's known as a Rogerian style and model of counseling. Or they could have done a 2-year diploma. Pretty much all psychologists, psychotherapists, and psychiatrists will be offering a form of counselling as part of their service delivery. Psychiatrists I'll deal with first because psychiatrists are medically trained in order to prescribe psychiatric medication. Only a doctor or a psychiatrist can prescribe antidepressants or other medication that might affect how your brain and psychology works. In Australia, psychiatrists can but seldom provide psychotherapy, mainly because it's simply too much. It's enough to be able to counsel and understand someone and what medication they might need or what diagnosis they may need to have in order to provide the right medication. And there's a high waiting list and a high demand for psychiatrists. Their fees are high because their training was so long and costly. So I'm not saying all psychiatrists do not provide psychotherapy at all. I'm saying that their main focus is probably on diagnosing a high-need psychiatric disorder and trying to work out what the right medication is for the person. So the main difference between a psychologist and a psychotherapist is training, and that is not immediately saying that one training is better than the other. They are different. Psychologists are educated at university. A psychology degree is conducted at an undergraduate level, usually across the span of 4 years at a university, where the student will learn different forms of psychopathology. They'll be trained in statistical analysis that they may use in their postgraduate or in their final years at university. They will be able to read research papers and conduct research, and they are primarily trained in the scientist practitioner model. So it's very science research based, especially the first 3 to 4 years. There is virtually no clinical training throughout those years. And by clinical training, I mean the capacity to know how to do counselling, to be able to sit face to face with a person. That often happens in the last 2 years, where the person with the psychology degree becomes a psychologist. Sometimes it's a specialization. They may do a master's in counseling psychology. They might do a master's in health psychology or clinical psychology. The standard modality that psychologists use, be it a registered psychologist that has done 4 years university and 2 years clinical supervised practice, or the person who's gone through a master's degree where they do supervised practice and a master's thesis, so they're doing research at that same time as well. They will usually be trained in delivering CBT, also known as cognitive behavioral therapy. Cognitive behavioral therapy is a very formulated and well-researched modality for helping people understand how their thoughts and feelings are playing into the mood or the emotional issues. On the other hand, you have psychotherapists. Psychoanalytic training is just one model of psychotherapy. There are many. And psychotherapy training would characteristically involve at least 3 to 4 years of study also. Full-time at university might be 20 hours. Full-time psychotherapy training may not be as much, but it is absolutely focused on the development of the personality, the emotional dynamics, ego formation, personality disturbances, and also how to be in therapeutic relationship. I feel the defining feature between a psychologist and a psychotherapist is that most, although I cannot say all, psychotherapy training requires that the psychotherapist does their own personal work. That means that they engage in their own personal psychotherapy or counselling as part of their training. And also they have significantly more clinical practice hours that they need to conduct, meaning they're actually working with the person and they're going back to a supervisor and discussing what they did right, what they did wrong, having that practice with people supervised. In fact, in order to get into a Psychotherapists and Counsellors Federation of Australia, you have to have done 600 client face-to-face hours, which could be telehealth also, before you can register yourself as a clinical psychotherapist. Whereas the registered psychologist, for example, it used to be 60 hours when I graduated. I think it's an awful lot, many more hours, but it's nowhere near 600 hours of face-to-face client work that you have to do reporting to a supervisor before you can put your shingle out and take in clients as an independent psychologist. So I feel the training standards in terms of face-to-face therapeutic work are far more intense for a psychotherapist than they are for a psychologist. However, the psychotherapist is not recognised, unfortunately, by Medicare, so that the clients cannot get a rebate. And this tends to bias people towards seeing a psychologist, because a doctor is far more likely to recommend a psychologist because they have a list of them from the society, and they know that they can get the rebates and they're under Medicare, and they know that they've been through a X amount of training. With a psychotherapist, unless they are registered with an organisation, somebody could call themselves a psychotherapist, as much as probably someone could call themselves a psychologist, without having matriculated properly into the amount of training that they should have. But the term psychotherapist, as is the term psychologist, are coveted titles. So that means that it is actually illegal for someone to call themselves a psychologist if they are not registered with the Australian Health Practitioners Regulation Authority, APRA. It's a coveted title that only psychologists that have been through the 4 to 6 or 7 years of university training can use, and that have done their clinical practice and that are registered as a psychologist. A psychotherapist also needs to register, but you probably do want to see that they are a member of ACAP or ACA, Australian Counsellors Association, or the PACFA, which is the Psychotherapists and Counsellors Federation of Australia. That means that they've done probably 4 years of training in the psychotherapy model. That could be a specific one, it could be a generic one, and that they have done well over 600 hours of face-to-face client practical work before they can register themselves as a psychotherapist. You can also be fairly certain that along the pathway of doing these 600 hours, that their psychotherapist supervisor has encouraged them, if it hasn't been a requirement of their training, to do their own personal work. And because it's a very intimate, intense relationship. People come in and they're telling their therapist or their counsellor or their psychologist their deepest, darkest feelings, secrets, and emotions. So a lot can go wrong because obviously these things are very activating and very triggering, and people are in a very vulnerable state. And so a psychotherapist has gone through their own personal journey. And I'm not saying that means that they're completely healed or better. I don't know if anyone is in that way, shape or form. But many people are drawn to the profession of helping because they know how it feels to be hurt. We know in first year psychology it's that half of the 500 strong auditorium actually need to see a psychologist, not become one. People are drawn to the field because they may have experienced their own trauma, suffering, adversity, and we often, invert that in a desire to help others. And there's nothing wrong with that. That is not a judgment. It is simply a truth that we are drawn to certain professions because it's meaningful to us. The person who has gone through the psychotherapy training has had the experience of sitting in the client's seat. They know what it is like to be on the receiving end of the empathic listening or the person who's constructively trying to help, and they know how to unpack what's going on for them in a safe environment and how to manage it. I am not 100% certain that all psychologists have done that because I know they're not required to. They do have to have supervision, and the supervision is usually around how are you working with your clients? What are you doing? What do you need help with? What's coming up in your client load that you're struggling with? And so a more senior psychologist will supervise, and they have to, psychologists have to do 10 hours a year of their own practice supervision. But it doesn't necessarily mean that they have to do their own personal emotional work. I'm sure many of them do, and I'm sure many of them have. But it's not a training requirement. It's not inherent in the scientist practitioner model that you have to be in that state of vulnerability where you are the one sitting in the seat of the client asking for help, spilling out your emotions, trying to understand what activates you and so forth. Most of the psychotherapists I know have and continue to do their own personal work. And that's certainly true on my journey. Now, I'm not plugging myself, I'm describing things to you. And I'm not saying either is better or worse. People are who they are. And I think it's really important at the end of the day that whoever you're working with or is working with you on your emotional, psychological problems, that you feel a sense of rapport and safety with them. That is the prime feature of what really works in psychotherapy and healing and counselling. Your ability to change can be modeled from a cognitive behavior therapy model. You can get tools and skills of how to limit your panic attacks and upregulate your depressive moods. That's absolutely researched, 100% true. But if you want to go through the deeper work, then a psychotherapist is probably the way to go. Now, this is because the psychotherapist can, and I'm not saying psychologists can't do this, and I'm just saying the training of a psychotherapist is more oriented towards personal growth, healing, emotions, and understanding how the personality develops. This doesn't mean that they're all going, psychoanalytically sitting in the couch talking about your childhood. You should be able to talk about these things with either practitioner. But I know from my own training that most of my skills do come from my psychotherapy training. I was trained in Gestalt therapy. It was highly emotionally focused. It works with the split off parts like family systems, internal family systems therapy, for example, works with the fragmented parts of the inner self, as did Gestalt therapy. We worked with parts, right from the very beginning. I'm not too sure how psychologists trained purely in the scientist practitioner model deal with those things. Many of them are equipped to deal with personality disorders, with fragmented self, with disassociation, absolutely 100%. But I feel that most of them would do postgraduate training in those modalities. So I hope this has provided a sort of an explanation. Obviously, this is from my own experience and point of view, and I'm not saying one is better from the other. But you now understand that psychologists are trained at university, psychiatrists are trained as a medical doctor so that they can prescribe psychiatric medications, and psychotherapists are trained intensely in many or one psychotherapeutic model. You would need to look at the individual psychotherapeutic model of the person that you are going to and see if it resonates. But at the end of the day, most of us end up what we call eclectic. That is, psychologists and psychotherapists alike can borrow from many different therapies according to what the client needs. After all, you are who we are there for. And at the end of the day, again, as I said, it's the relationship and the rapport that you build with your therapist that is probably going to be the most defining feature in your healing journey. There is not just one person that can help you. There are many. It is a consumer market, so you're welcome to shop around. You don't have to go to the psychologist that your doctor gave you the referral to, and you don't have to go to the psychotherapist or counsellor that your friend said was good. You need to feel what fits for you at the end of the day. And sometimes you might see someone for a little while and go, okay, well, that was useful. I got some self-awareness and something out of that, but maybe you find someone else down the track. Personal growth is an unfolding path. So I hope this is helpful to you. I hope you have a better understanding of the difference in different professions that can help you with your mental health and emotional problems. If you did enjoy this video, please hit the like button. If you like my information, you may subscribe to my YouTube channel also. Thank you for joining me, and I hope you have gained some understanding that will help you decide and make decisions moving forward.